Hi everyone, welcome to my YouTube channel. Thanks for coming again. My name is Habiba. You can call me Abby, you can call me Habiba, whichever one you want. What matters is thank you for coming again. And it's always a pleasure to have you again. And if it's your first time coming in, thank you, you're most welcome. Habiba is a registered mental health and substance use nurse living in Canada, and I also had my master's in global mental health. I'm passionate in promoting mental health and well-being, which is why I created this channel. You're also lucky. You all are lucky because I'm going to be giving you lots of tips today. So today's topic is going to focus on finance and mental health. Mental health is a state of emotional, psychological, and social well-being of an individual. It affects the way the person thinks, feels, and acts. It also determines how the person manages stress, relationship with people, and how the person make healthy choices. Talking about choices. You learn a lot about choices here. Okay, let's get it on. Today's topic might be quite sensitive, but I'll try as much as I can to not make it that. I'll level it. I'll level it, tone it down. So apparently I'm taking you down memory lane, more like a reflective scene or talk. Let's put it that way. We all experienced the COVID pandemic and it affected almost everybody one way or the other, even if you never went out or maybe you had families. Some people lost their loved ones, some people lost their jobs, some people had mental health crisis, and it was really, really not funny. However, some of us survived and some didn't, unfortunately. That's why I said this is quite sensitive. But there's a question: how did people manage their finances that period? I mean, what was their mental state about? How did they cope? Tell me about this in the comment section. How was it for you? Tell me about the coping skills you used to manage your financial stressors at that time, if you were affected by unemployment or if you were affected by investments that went down the drain. Yes, some organizations crumbled. Some business owners lost so many. I just want to know your own view on how you manage your stressors at that time, your financial stressors. It will be fun to have an interactive session down there in the comment below. There's also this part of anxiety I need to stress that is normal, which some of us had. When you're expecting, I worked in a COVID unit at that time, but I think I was determined to help people who needed this help based on the kind of job I have found myself and I have loved to do. Not just found myself, I loved to do it. It's our calling, right? So it was anxiety, but it was a positive one. And just so you know, the National Institute of Mental Health states that occasional anxiety is normal for everyone. And this is because some things just does happen. It's part of our life, like family problems, money problems, health problems. They are normal part of our lives. Anxiety disorder only happens when it's more than the temporary fear and worries. And it would also happen if it takes a longer time consistently, and most times it gets intense over months and even years. It does interfere with everybody's normal, I mean, whoever it happens to, it does interferes with their daily functioning. I mean, their activities of daily living to include work performances, schoolwork, interpersonal relationship with people. Symptoms can include restlessness, fatigue, tired or exhausted. It can involve inability to sleep well or even oversleeping, inability to concentrate, physical symptoms like body pain, headache, irritability, and a host of others. However, I'm not talking about anxiety here. It's just to clarify between the normal anxiety and the one that becomes a disorder. And just so you know, it's important to understand that has to happen for persistent period of time and it will be intense. This is more associated with generalized anxiety disorder. I would say this is an era where Gen Zs and millennials, oh no, I don't know how you're coping with inflation rising, and it's relative to both high income countries and low middle income countries. Cost of food is high, school fees is who, house rent high, mortgages, interest is wild. Oh my goodness, everything is just. And then there's the influence of social media. How are you managing this without running into debt? Mm. Tell us in the comment section below. I want to know. I really want to know. Remember, we are all learning together. Some people are going to benefit from what you have to say and how you're coping without debt in this kind of melting pot. Okay, as we were saying, we're talking about debt in relationships. When it comes to financial constraints, there's usually tough arguments. And if there's tough arguments, there's high susceptibility for irritability. And if there's high irritability, there could be resentment. If there's resentment, there could be toxicity. If there's toxicity, if it's not well taken care of by probably introducing effective communication skills, good problem solving skills, if it's not well taken care of by all of this, there's high chances for someone feeling rejected. And that can also be worsening into depression and all forms of mental health symptoms. Well, if you don't want to go down to that level of deterioration, having a diagnosis, then you want to try incorporate some healthy coping habits like self-care, exploring various coping skills that would align with your personality. And you'll want to also try to inculcate some stress management techniques, some which could include meditation, mindfulness, exercise, whatever works for you. And there's also the part of seeking support from family members, trusted friends, people that can hear you, listen to you, empathize with you, show you compassion. It's very important, especially in this type of era we're in. There's so much distractions everywhere. So please, it's important to utilize those resources around us. Community support is also very important. But in all of this, if things are not progressing, it's important to seek help medically. Mental health awareness is getting more available to every one of us. And that's part of why I'm establishing this platform, to also blow the trumpets for all of us. It's also good to note that we have clinicians like the clinical counselor, the clinical therapist, the psychologist, clinical psychologist. It's always good to consult them for any support you need to evaluate your mental health status. And then the psychiatrist and the mental health and substance use nurses, they all have useful resources and treatment to help support your mental health symptoms. Early intervention would definitely yield a good prognosis. So please take charge of your health. I would leave you with 3 tips of how to maintain a positive mental health. According to the Canadian Public Health Services, taking ownership of your life experiences and not blaming your situation on events beyond your control is very crucial. It's crucial to eat well as well, and it's very important to help people to feel included in your community. And this can be done by making or planning barbecue sessions, running and writing programs, all to just make everyone inclusive with each other. I hope you gained something today from this discussion, and I will love to gain more from you in the comment section as well. I would like you to subscribe to my YouTube channel. Please like, share, click the notification button. Thank you for listening as always, and Have a great week ahead. It's your girl, Abby. I stay humble and I totally appreciate your time. Have a great week ahead and see you next week.